Hello, folks, and welcome to Morgan Hill Health TV. My name is Bernie Mulligan, your host. The Morgan Hill Community Health is sponsored by the Morgan Hill Community Health Foundation. The goal of this TV show is to provide general health-related information to the residents of Morgan Hill. The mission of the Morgan Hill Community Health Foundation is to contribute to the health of the community by ensuring the availability and accessibility of health and medical services, including community health education, for the benefit of the residents of the Morgan Hill and surrounding area. Our special guest today is Ted Fox, the President and CEO of St. Louis Regional Hospital. Ted, I got a question for you. Since the Daughters of Charity removed their hospital from CHW, what changes have been made to the St. Louis Regional Hospital?
Well, there have been quite a number of changes, and it really starts with the mission and the values of the hospital. The Daughters of Health, the Daughters of Charity go back over 450 years to serving the sick and the poor, and they bring that mission with them now as a part of the Daughters of Charity health system. Also our values, our Vincentian values that come down from St. Vincent, and actually our namesake, the co-founder of the Daughters of Charity, St. Louise de Marillac, and our hospital is named after her, so we have a special responsibility and an honor in that regard. To take care of the sick and the poor, to provide spiritual care as well to individuals in the community. Another thing, there's been a renewed emphasis on community benefit regarding health care, and for example, this year in the first 6 months of our fiscal year, we've provided in excess of $4.5 million worth of community benefit through our little hospital in Gilroy. There was a real focus in the Daughters of Charity system now on local health ministries and the local population and having local people meet local needs. The Catholic Healthcare West model was going to a more centralized and controlled type of system, and the folks in the Daughters of Charity really want us to be attentive to the local needs, local providers and local facilities providing local services. And to that end, each hospital was established separately as a religious nonprofit organization that is part of its community and engaged in its community and has local governance. A local board of directors was appointed by the Daughters of Charity Health System, and it includes, of course, members of the Daughters of Charity, but also local citizens who are involved in the board, local doctors, etc. We also have local committee structures, for instance, on our finance committee, and we in fact have a new committee of the board called the Morgan Hill Community Advisory Board, which is a committee of the board of directors of the hospital. We are also setting about establishing a St. Louis Regional Hospital Foundation now, and that'll be dedicated to raising funds to help us meet the needs of the local community, and that's a new advent with the Daughters of Charity. Further, we also, not long after joining the Daughters of Charity Health System, embarked on a new strategic planning process, and was very thorough, very comprehensive. It took us about 4 months and engaged one of the better-known strategic planning firms in the nation for healthcare, and that's been something that's been extremely helpful in terms of us pointing our direction and looking towards the future. Also, since the Daughters came in, we've made tremendous investments in new technology and services and things of that nature, such as a brand new state-of-the-art MRI scanner, which was an investment of $1.5 million. We have brand new beds and stretchers at the hospital, an investment of about $500,000. A new nuclear medicine camera that we're in the process of buying. It costs in excess of $400,000. Patient room improvements that we'll be doing at about $250,000, et cetera, et cetera. So a lot of investment in the services and the equipment, the tools that people use as well. Further, a lot of investment too in people, physician recruitment, also making sure that we're well positioned to both recruit and retain, in particular, our valued associates at the hospital as well. So we've been able to do that in competition with the hospitals, for instance, up in the San Jose area. Another thing, and last but not least, but was a renewed emphasis by the Daughters of Charity in the services here in Morgan Hill. And as you may know, the Daughters of Charity founded St. Louis Hospital here in Morgan Hill. And once coming back in, they really have had a renewed interest in terms of the facility and the services here, and promptly stepped out with the Morgan Hill Community Health Foundation and setting up a joint planning task force to do some joint planning as far as the community needs and find out where the gaps were and things of that nature as well.
That's great. That's great. Yeah. Great. Probably one of the things that we were pretty much interested here in Morgan Hill locally, the medical office building on the Morgan Hill campus has been reopened.
Right.
We're happy to see that.
Yeah.
And what plans do you have for the St. Louis Regional Hospital for for this medical office building right now?
Well, let me give you a little background on the medical office building, and it dates my arrival here. But I'm told that building was open and operating before the hospital was, and so it's on separate infrastructure, meaning all the utilities and the heating, ventilation, and air conditioning, and plumbing, and things of that nature are on their own. So we could fire up that plant by itself. That's on the north end of the campus, without having to really impact the hospital building, the main hospital building itself. So it's 30,000 square feet. It has 10 suites of offices in there, and we now have one of the suites occupied by 2 new OBGYNs. The Gilpins are up on the top floor. And we're also in discussions now with some other physicians, as well as some other healthcare providers about occupying some space in the medical office building too. Wow. And we'll be looking also to see what other types of services that we can put in there that will benefit the community and also help us as a hospital meet the needs.
Great.
Yeah.
Citizens and people are going to be happy to hear that. They really will.
We'll keep working on it.
What's the status of the main hospital building actually now?
Well, one of the major initiatives in our strategic plan that I mentioned earlier was to look at the overall Morgan Hill campus. So we have had an ongoing strategic initiative also that's dedicated to looking at that specifically. We don't have plans firmed up as of yet. But we hope to in the not too distant future and be able to say what it is that we're going to be doing or attempting to do there. So
wonderful.
Yeah.
Glad to hear it. Ted, could you expand a little bit on the St. Louis Regional Hospital, the people and their services?
Oh, you bet. I'd be glad to. We are, again, a member of the Daughters of Charity Health System, and it's our local health ministry here is really made up of people who we try to give the tools and facilities to be able to care for our local citizens. They're folks that you probably know, many of them. They're very enthused. They're members of our local churches and service clubs and other types of organizations. They're your neighbors, and they're even members of your family as well. We have over 430 associates, as we call our employees, in dozens of job categories, and in excess of 100 physicians on our medical staff as well, and just a variety of different specialties, and that includes 8 new recruits that we've been able to recruit into this area. We also have 105 volunteers that are members of our volunteer group at the hospital from this area, and they do a great job. You see them, people oftentimes call them the pink ladies, that you see at the hospital. They're great volunteers. We serve quite a number of patients. In our last fiscal year, we served about 3,500 inpatients and had 700 babies born at the hospital. That's a joyous occasion. Many times folks are sick when they come, so it's neat to have this as well. We had about 21,000 ER visits come through our hospital, and that's a tremendous volume for the size of ER that we have and for the size of hospital that we have. And we also did over 3,000 surgeries in our ORs. We have 3 ORs and a special procedure room and a C-section room as well, and 119,000 lab tests. So a lot of folks come to us to get diagnostic tests, which include both the lab and the radiology also, where we did about 33,000 x-rays and ultrasounds and things of that nature. One of the things that people don't think about very often is the fact that when you have a lot of people that are housed in a building, you also have to do things like feed them and got to have sheets on the beds, God darn it. And we served about 240,000 meals in our last fiscal year, so a tremendous amount of meal service, and we have a Meals on Wheels program that we do for the community as well. And 395,000 pounds of laundry, so that's something to put in your washer and dryer and work on. But we needed to have those as well for serving our community. And we had over 1,000 health education and health promotion participants throughout the year, too, as well. Now, we have 30 different hospital departments, and that's dozens of different services, including X-ray and MRI and hematology and microbiology and labor delivery and recovery and our own pharmacy and our emergency room and cardiac care and ICU, et cetera, et cetera. And we have 30 physician specialties. That includes family practice and internal medicine, OBGYN, ear, nose, and throat specialists, orthopedics, general surgery, neurology, et cetera, et cetera. So a great number of very qualified individuals on our medical staff as well as our associates to be able to take care of folks. St. Louis Regional has 93 staffed inpatient beds, and we also have skilled nursing facility with 23 beds and 4 labor delivery recovery beds. And we have 2 campuses, as we know, both Gilroy and Morgan Hill, and up here we have 41 acute care beds and 19 skilled nursing beds with 6 ER stations and 4 ORs. So that's something that we're looking to see what it is that we can do with that to help meet the needs of that. Now, let me go back a little bit and talk a little bit more about the tools that we have and the investments in equipment and technology that we've done. Our MRI scanner, as I mentioned, cost about $1.5 million, and that replaced a part-time scanner that we had coming in. It was about 2/3 of the current strength magnet that we have, so we have the latest and greatest in that. Plus, it offers a lot of procedures and things that were not available. We've also purchased a brand new ultrasound machine that will give excellent images and be able to serve the needs of the community. We have 2 mammography machines now that are brand new, and in fact we were named a show site by General Electric because of the quality of our equipment and the quality of the services that we render for the women in the area. Our beds and gurneys replaced house-wide, and they're just fantastic. That was the result of a grant from the Daughters of Charity Foundation. And our new ICU beds, for instance, they can weigh the patient right in the bed. The patient doesn't have to get out and, with all the tubes attached and everything. It's great. And our new gurneys down in the ER, for instance, are wider, and they're, people that have been there will be happy to know that the mattresses are thicker, too, so that'll be a lot better comfort. That's right. The totals just for the above listed stuff is about $3.2 million. And I mean, we've spent a lot of money in the Daughters of Charity Health system in terms of upgrading our instruments and tools and stuff like that. We've also made tremendous investments in people, for instance, in physician recruitment, $1.3 million. Our annualized payroll at the hospital runs about $21 million, so we're a major employer in the area and provider of payroll. Also, we have benefits of about $4.4 million in terms of health care benefits and retirement and things of that nature as well. And we buy about $25 million worth of supplies each year. Just in Morgan Hill alone, we've invested in excess of $700,000, almost $750,000 in terms of reactivating the medical office building, recruiting physicians and things of that nature. So big investment up here in the community and in the services.
Well, we thank you for that. We thank you very much.
Well, the Daughters of Charity have really had an emphasis on focusing in on the local community, and they put their money right into the local services, too. Much of what we've been able to do is because of grants that were provided by the Daughters of Charity Foundation.
I want to thank you very much for coming here today. This is Vivian Smith. Vivian is the Director of Physician Recruitment for St. Louis Regional. A few questions for you, Vivian. One would be, how do you start the physician recruitment process?
What we start with is a community needs assessment. It always starts with anecdotal information because sometimes you hear stories, I can't get in to see my primary care physician, or I can't find an OBGYN in this area. And so from that, we do a community needs assessment. We take a look at the zip codes in our primary and secondary service area, the population in those zip codes, and then how many doctors there are to serve that population in any given specialty. It has to be specific to the service area, too, and it has to be completely objective third-party data.
I see. And where do you find doctors at, basically?
Well, we look at several ways. I use a recruiter sometimes for hard-to-find specialties, and there's always physicians that have connections out in the community or other communities. They go to trade shows and they hear of someone who may be looking for another opportunity. And we also use, sometimes I go to the fellowship or residency programs themselves. When I know that I may want 3 or 4 primary care physicians, then I visit a school or I contact them to see if they have any that are ready.
And like what kind of agreement would you offer a typical physician?
What we do is we calculate the amount of the agreement on certain criteria. We have to use fair market. We can't give a physician more than what is fair market for our particular area. So it includes expenses. We take a look. Again, I use third-party data, so it could be very objective. And we offer an income guarantee for 1 year and then forgiveness over a 4-year period. So that income guarantee for the first year covers their income and expenses. And then they have certain obligations to meet after that. One is to remain in the community and serve the community, to serve all payer classes. And in order for us to forgive whatever monies we gave them.
I see. Well, the Morgan Hill Community Health Foundation is very concerned about physician recruitment, and we'd like to help you maybe raise some funds on our end of it as far as getting this program going.
That would be great because, as I said, for St. Louis, we recruit to the service area, and that means that the physician has a choice of where they want to locate. They could go to Hollister or Gilroy or Morgan Hill. So in order for them to want to come to Morgan Hill, that's a nice addition.
You betcha. How expensive it is to recruit a physician, for example?
Oh, it's very costly.
Yeah.
It costs several $100,000s of dollars. We have recruitment fees. If we use a recruiter, we pay relocation, and we also guarantee the income and expenses. For a primary care physician, it could probably start somewhere in the $200,000s up, but for specialists in certain specialties, it costs several $100,000.
Are there any restrictions or guidelines in the recruitment process? For example, why can't we bring a doctor just from Gilroy to Morgan Hill?
Well, the Morgan Hill Community Health Foundation might be able to, but the hospital can't. We have certain guidelines and restrictions and are held to certain regulations, whether they be federal or state. We have Stark, we have fraud and abuse, we have the anti-kickback, and we have inurement because we're a not-for-profit. So our guidelines are that we have to have a physician come from outside of our service area, number one. Number two, they could be a recent graduate of a fellowship program or of a residency program, and that's fine too. Their practice must be derived from mainly new patients, and our guideline is about 85% of their patients have to be new patients. So if you take a crosstown recruit, if you take someone from Gilroy to Morgan Hill, then their patients could follow them.
Morgan Hill's in dire need of physicians, and can you kind of tell me where you're at in this process right now, maybe?
Sure. Our plan is to recruit 4 primary care physicians next year within the fiscal year to Morgan Hill. And we feel like we need a good primary care base before we recruit more specialists. We are in process of one recruitment, and once that's the agreement signed, then we can make an announcement. And we have a couple of other doctors, too, that are interested in the area.
Excellent. I think it's critical that the community support your efforts. One of the things that we need to do is work with our employers, that they use plans that have doctors, that local doctors are used, and that our community supports those local doctors. These are critical points. It's amazing. Well, I want to thank you for your time today, and we certainly hope we can help you and move this forward. The people in Morgan Hill are looking forward to it.
Well, thank you.